In one of our recent studies from the Acute Leukemia Working Party of the European Society for Blood and Marrow Transplantation, actually we have tested the question asked, we have asked the question of whether allogeneic stem cell transplantation would have similar results in secondary ALL compared to de novo acute lymphoblastic leukemia. And this question is important because in general, in hematology and in the transplant field, we believe that those hematological malignancies, which are secondary malignancies, their prognosis is going to be lower, inferior, compared to those patients with de novo diagnosis. Actually, when we did this comparison based on the EBMT registry, we were happily surprised to see that the results are similar, whether you consider non-relapse mortality, whether you consider leukemia-free survival, but also if you consider a composite endpoint of graft versus host disease and relapse-free survival. So it looks like that allogeneic stem cell transplantation is able to overcome the dismal outcome of secondary ALL. And this was also shown in the paper which has been published in early 2024, I think, even not only on the whole group of patients, but also when we did a very stringent pair-matched analysis, taking into account all the different parameters and confounding factors, and we found the same result. So I think these results are quite reassuring, and whenever it is needed and feasible and possible, I think those patients with secondary ALL who are eligible to allotransplant could proceed to allotransplant based on these results.